Hello, I'm Jim Thomas. I'm an epidemiology professor with the University of North Carolina at Chapel Hill. The kind of epidemiology that I do is social epidemiology. I look at the social forces that shape the patterns of disease in society. I want to talk to you today about a broad social force, climate change, and how it affects mental health. Let me share my screen with you to get to my slides. So I'm going to talk with you about how climate change and mental health relate, or as I've worded it here, how climate changes mental health. One of the interesting things about this combination of climate change and mental health is how they are both ubiquitous. This stands in contrast to other social factors that I have researched, like mass incarceration, which affects a portion of the population, but not everyone. And the health outcomes from incarceration in communities, some of the population is affected by it, but not everyone. With climate change, it is ubiquitous. Everyone experiences it, everyone contributes to it, and everyone can take steps to mitigate it. Mental health, likewise, everyone experiences mental health at one point in time or another, if not frequently, experiencing dips in mental health. And everyone affects others' mental health. We have profound impacts on each other, and we can each take steps to lessen the negative factors, the factors that have a negative impact on mental health. So these two are ubiquitous in life. We're also dealing with an unprecedented factor that is affecting our health. You can see that the population growth here, even since the 1980s, has taken a tremendous leap in numbers. In the black line, you see it climbing here, and the blue line climbing with it are the carbon emissions that have come from the increased consumption and production of this growing number of people. It has not been seen before in history. This line, if it were to be extended back to the left, would go back thousands of years. And already around 1863, you see that it's basically at zero, according to the scale of this graph. So this is, even though there have been ups and downs in the heat of the planet, we have not experienced anything like we are right now. This makes it an urgent thing to deal with. It is unprecedented, it is ubiquitous, and it has been claimed by some top medical journals, Lancet, British Medical Journal, that climate change is the greatest threat to public health. So there's a lot that has to be done in every facet of public health. It's not hard to see the connection between climate change and mental health. If we just take one example, if we go to Bangladesh and we consider the rising sea levels that they're rising because the polar ice caps are melting. As they melt, there are greater surges with the storms. So when there is a cyclone in that region of the world, it quickly floods the lands that people are living on, and they have to evacuate their homes. You can just begin to imagine the kinds of questions that are thrust upon people who have had to leave their homes. They might wonder, well, how much have I lost, and how permanently have I lost it? Who have I lost? Perhaps in evacuating, a child or an elderly adult has been unable to escape and has been caught in a flood and has died. Where will I live now if I can't be where I was raised and have lived all my life? I will go into the city, but I don't have any place to live there. How am I going to manage? And how will I feed my family in the long term? This land that I have had to leave was my farmland or my fishing port. And how am I going to manage without that? Because that is all I have known. So these effects, these questions dig deeply into our lives and our sense of meaning and our responsibilities of caring for other people. They can take an emotional toll, like anger. Sometimes anger is international, because those in Bangladesh in this previous photo probably didn't contribute much to the carbon emissions that cause climate change. That was probably done a lot more by me and people here with me in the United States. So the Bangladeshis could be angry with those of us in the US who have such a high consumption pattern. Or it can be intergenerational, because those who are young adults right now could harbor resentment and anger to the older generations and how they have left a world that seems untenable. There's anxiety about what's coming next, and perhaps for younger people, younger adults, whether they should have children. Do they want to bring children into this world where it seems like the apocalypse is upon us? Denial is one of the easier ways out of it, to just mentally close off to this notion that the world is changing, and perhaps irrevocably. And that, of course, can lead to even greater climate change, because with denial, one doesn't change their behaviors. One doesn't contribute to the change that is needed. And then depression can easily result from those who have lost their homes, for example, the climate refugees, or from those of us who are just reading the news and are affected deeply by the pictures and the images that are coming before us. Some Stanford researchers have found that warming temperatures could increase suicide rates. They did this study looking at social media and the uses of words like loneliness, isolation, and found that when those words increase in social media, that rates of suicide also increase. And those words and suicide in turn correlate with increased climate or increased warming. So as you can imagine, depression often results in suicide, and that could be one of the sadder effects of climate change, sadder mental health effects. There is a more general experience that people have that is called climate grief. For those who are not in denial, those who are paying attention to the changes that are occurring, there is a lot of grief about what they are seeing. I, for myself, for example, was in Alaska some years ago, looking at glaciers and seeing how they had shrunk back over time because of the changes in climate, and then imagining that in another 10 years, they might be gone altogether. And that does make one sad. I was experiencing and continue to experience climate grief. If you can read the bottom line of this page here from a website called Climate in Mind, and you can see the URL for Climate in Mind at the bottom. That bottom line on the white page says, if you have ever felt hopeless or scared about the future of the planet and the ecological system, and the future that your children, your family, and all future generations might inherit. That's an example that they are giving of climate grief. Well, these effects are cyclical. It's not just that climate affects mental health, but mental health can affect climate. So here we see from California, it's wildfire season. And this article is saying that firefighters, their crews are understaffed. And then as you read the content of the article, you see that one of the factors that causes people to leave that work is exhaustion. Having fought fires and feeling that they're just unrelenting. And the fires are becoming hotter than they were decades ago. So it's harder to fight fires. And many of the firefighters are volunteers. So they reach a point where they say, I'm volunteering for this. I don't need to come back. I'm not coming back. I need to rest and recuperate. But with fewer firefighters, then the fires spread further. So the effects of climate change are greater, and perhaps more homes are burnt down because those fires are out of control. And here is a statement by a woman scientist, freshwater and ecosystem expert, Sandra Postel, who says that psychology, as much as science, will thus determine the planet's fate, because action depends on overcoming denial, among the most paralyzing of human responses. So with these ubiquitous effects, the ubiquity of climate change and its effects on mental health, we have to adapt because of the extent of this emergency. It's going to overwhelm our systems, as this article shows from the Washington Post. It's going to strain our mental health system. It's time to adapt. And to adapt, it's going to require that the response also be ubiquitous, that everybody on the planet do something to make some changes. So I'm going to mention a few of those changes that are possible. Let's start with ourselves. The first thing we can do is consider how much carbon we are generating. There are numerous carbon calculators on the internet. Here's an example of just one of them. So you can go in here and plug in data and assess how much carbon you are generating, and then get some ideas about how you can cut back on that. One of the things that we are doing right now in talking by Zoom rather than gathering in person. Now we're doing that, we're not gathering in person, and largely because of COVID and the need to stay apart from each other. But there are some actual positive outcomes that have come from learning how to communicate digitally rather than in person. We haven't generated all that carbon by flying to see each other or taking trains or whatever it would be. We are talking virtually and therefore saving that carbon output. So there's, shall we say, a glass half full or quarter full from Zoom. There's a lot that we don't like about it, but there are some gains as well. There are a number of resources that I could mention. One of them is from a group. It looks like my image down in the lower left has obscured the URL. I'm going to move myself, and it says allwecansave.earth is the URL for this site. And they have what are called circles that are around these topics. They are discussion circles. If you look at session 5 right here, it's called Reshape. It's about problems embedded in the contours of cities, transport, infrastructure, and capitalism. There's one discussion group. And then right below it, number 8, is a circle of discussion around Nourish. That's about soil, food, water, sky, inseparable, the foundations of our aliveness. There's another resource that is perhaps more focused on our response to climate change. This one is called Good Grief Network, and you can see the URL at the bottom. And they are addressing numbers of aspects that are affecting mental health because of climate change. There are professional resources that you can have. Reading up on the connection between mental health and climate change. This is a report that comes out of the American Psychological Association. And then going back to the page that you saw earlier, or the website rather, and this is a different page on that website of Climate and Mind. Again, the URL is at the bottom. But this one is about Climate and Mind curricula that can be used in graduate schools. If the font is a little bit small, but if you look across here, you can see other things that are offered on this site: where to find help, resources, psychological responses to the climate crisis, etc. So I recommend that as a site. I found some really good material there. Then I want to encourage you to be thinking in terms of systems. All of these different factors we've been talking about are interconnected, and this is a causal loop diagram that gives one perspective on how these connections occur. Your particular expertise in public health could fall in one of these circles, or other circles that would appear in another diagram of the causal loops, demonstrating the connection between climate change and mental health. But anytime you appear in a system like this, where you identify with one of the circles or nodes, as they are called, you're going to be connected with others, and knowing about them and knowing how to communicate with them or to receive their information is critical in being a public health professional today. There's very little room for specialists who don't understand adjacent systems and adjacent disciplines. So I want to encourage you to, yes, have your particular discipline, but then zoom out and think about those that are adjacent and what you need to know about them so that you can act more effectively within the system. One of the other systems thinking approaches is decision making, and here is an image of a community making some decisions. And this could be a picture of you. Perhaps you wouldn't be dressed as colorfully as this, but you are a group of people who have gathered together to consider and inform each other from different perspectives about the issue of climate change and mental health. The World Health Organization does this kind of thing and then advocates for the kinds of change that need to occur. I want to encourage you as you are thinking about your future to see how you can be an advocate. Even if climate change is not exactly the discipline or the question that you dive into, do consider how whatever you do touches on that ubiquitous topic that affects everyone, as well as the ubiquitous topic of mental health. So I want to thank you for the opportunity to speak with you, to talk about these topics. I want to congratulate you on what you have done to come together and consider this yourselves. And I appreciate the opportunity to share this time with you and to consider these really important issues. Thank you.